per year, but it is not for BPL, it is for EWS. So not included is the first one. And do remember, school health program comes under Ayushman Bharat, and it also comes under PHC Vision Center. Why school health program come under Ayushman Bharat? Because on every Tuesday, government is planning to celebrate Health and Wellness Day, on which health and wellness messenger, which will be boys and girl student, and health and wellness ambassador, which will be male and female teacher, they will motivate and train student for yoga, क्योंकि yoga से सब कुछ होगा. Okay, and when they are saying health and wellness center, they are just basically renaming PHC and sub center into health and wellness center. But along with renaming, they will have some extra facility, which can be asked what are the extra facility which is given. So extra facility given is, one is mental health, other is dental health, oral care, oral health. Then the third one is the ENT facility, and fourth is the ophthal facility. Fifth, they say, is the geriatric health, mostly diabetes and blood sugar treatment. Sixth is the palliative care for post-cancer patient pain relief. Then, of course, they will have yoga and meditation. Okay. So these all facilities will be added when PHC subcenter will become health and wellness center. And do remember, Ayushman Bharat, just like Food Safety Standard Authority of India, is run both by state and central government. State government give around 30 to 40% of budget, and central government give about remaining 60 to 70% of the budget. So both of them, they work together to run this program. Now this one question was one which came in recent exam, that a lady presented with mild spotting and no pain. What is the next best management which you will do? Will you give analgesics, remove IUCD? Will you give iron supplement and reassure, or will you give antibiotics? So the correct answer is iron supplement and reassure. It is directly from PARC, which say that if there is a spotting between period for 1 to 2 months, the patient who is experiencing it should receive iron tablets, and that iron tablet and reassurance should be done. But if the bleeding is heavy or persistent, then we should remove IUCD. Do remember, pain is the most common cause of removal of IUCD. You can remember it by the mnemonic PR. And bleeding is the most common side effect. Most common side effect is bleeding. Pain removal, PR. Okay. Then one more question came in recent exam is, up to which time after delivery you can insert IUCD? Up to which time after delivery? Option where 48 hour, 72 hour, or 5 day, or 6 week. So the answer is after delivery it is inserted up to 6 week. This is actually the best time to insert IUCD, because if you insert IUCD before 6 week after delivery, then it can lead to rupture of uterus, and there can also be expulsion of uterus, because at that time perpural post-delivery bleedings are occurring, and it can lead to high rate of expulsion. So the best time is this 6 week after delivery. It is known as post-perpural. Okay, we can also put it postpartum, but keeping it postpartum, as I said, can lead to rupture and can lead to high rate of expulsion. Now, a 32-year male presented to emergency ward following crush injury of hand. He had received TT injection at age of 25 years. So the gap between two TT is 7 years. Now they say that it is crush injury, that means dirty wound, other category wound. So what will be the management which you will do? Dr. Stefan is saying how many hour session? This session is just of half an hour, 30-minute session. Only 30-minute session. Okay. So do tell me what is the answer you think. If there is the crush injury which has occurred in 7 years, then we need not to think whether it's crush injury or clean wound. We will give DTTT only if there is history between 5 to 10 years someone has taken TT, then it is DTTT only between 5 to 10 years. And if it is less than 5 years, then no matter which category wound is there, we will only wash. So only wash in less than 5 year, and 5 to 10 year DTTT, no matter which category wound is there. Now the main thing is, when do we add immunoglobulin? We add it only if it is other category wound. So, and when do we give full course? We give full course only if patient has forgotten the last history. And if he had forgotten, then we will give full course. So this is what written in PARC also. Let me summarize this part. This is first category of wound, less than 6 hour. Okay, it's not clear, so let me say it. If it is less than 5 year, only wash. 5 to 10 year, only DT. If it is more than 10 year written, in case of more than 10 year, we check whether it's clean, less than 6 hour, non-penetrating and non-lacerating wound. In that case, we will again give DT only. Okay. So the management of clean wound is same after 5 year, no matter how much back they have taken it, the same DT will be due. But if it is other category wound, in case of other category, we will add along with DT tetanus immunoglobulin. And if it is history forgotten and clean wound, in that case we will give full course and no tetanus immunoglobulin. But if it is other category and history forgotten, then we will give full course plus tetanus immunoglobulin. So tetanus immunoglobulin only given in case of other category, not in case of clean wound less than 6 hour. I hope this diagram is clear to you and you will remember it. So in the above example, because the patient came in 7 year, no matter whether it's clean or crush, answer is DTTT. One confusing question they give is, let's say I say dirty wound 10 year back DT taken. What is the next management you will give? This was the NEET question. 10 year back DT taken. Clean wound or dirty wound? If they say 10 year back, answer is same DT, whether it's clean or dirty. If they say more than 10 year, when you find more than 10 year and dirty, then you will add tetanus immunoglobulin. If they say only 10 year, till 10 year, we do not add immunoglobulin. We add it after more than 10 year and after 10 year, okay? Now, a 10-year-old girl came for a health checkup and she is diagnosed as having moderate malnutrition. So she is already being diagnosed. Now RBSK cannot help. RBSK help in screening and then treatment, but she is having malnutrition and there is the treatment for malnutrition is the food. Where will she get the food? She can get it at midday meal or in PM Poshan if she is going to school, but she is not going to school. So she will get it under ICDS program. What is the difference between PM Poshan and midday meal? In PM Poshan, preschool children are also included. Preschool plus school children both are included. And what are the meal that we give? We give half protein, 1/3 calorie, because they can get calorie from rice in their home, but they are not getting protein. So we are giving more protein, less calorie. Now in the same question, if suppose this part diagnosed with moderate malnutrition is not written, only written is that a 10-year-old girl came for health checkup. She does not go to school, which program will help her? Then RBSK can help her, because RBSK people also do screening in Anganwadi. She will be screened and then she will be treated. But if she is already known to be a case of malnutrition, then we will directly send her to Anganwadi. Next is, which of the following is direct cause of maternal death? A very confusing question for many students. One of the teacher also told that direct cause can be anemia, but no, anemia is an indirect cause. All of these three are indirect cause. Anemia, heart disease, diabetes are indirect. Direct is embolism. It is again directly from PARC textbook. You can see indirect cause are anemia, malaria, heart disease. Direct cause include ectopic pregnancy, embolism, and anesthesia related death. So remember that question. Now, a lot of time they ask question with the same data again and again. They can ask either neonatal mortality or perinatal mortality. And whenever they say total birth and then stillbirth, so we all know, I hope, कि live birth is total birth minus stillbirth. So here live birth is 4050 minus 50, 4000. This is the live birth, 4000. Now look at the point what they are asking, neonatal. So if they are asking neonatal, we all know is birth to first 28 day. In the first 7 day, they said 150 death. Then 7 to 28 death, they said 50 death. So total death which occur in the neonatal period is 200. And for this diagram I have drawn because for all the definition, whether it's perinatal, neonatal, postneonatal, infant mortality, in all the definition, two things are common. Live birth is common and multiplied by 1000 is common. You only have to write the duration and the formula will be clear to you. Like neonatal, what is the duration? First 7 day plus 7 to 28 day, and it will become neonatal mortality. So first 7 day they have given 150, 7 to 28 days they have given 50. Live birth we have calculated 4000, so this 30 will cancel out. 200 by 4 will come 50. In the same question, in place of asking neonatal mortality, they can also ask perinatal mortality. So if they ask perinatal, we all know peri means around. So it is 22 week to birth, which is stillbirth, plus first 7 days, this is perinatal. So stillbirth was given 50, early neonatal is 150. So if they ask perinatal mortality, again it is 250 plus 150 divided by 4000 and multiplied by 1000, so that will also come 50. Whether they ask perinatal or neonatal, in that data answer will be same, 50. Now one point remember, they can ask which is not included in infant death. So you can see infant death include early neonatal, late neonatal, post neonatal, but it do not completely include perinatal. Perinatal is not completely included in infant death. Okay, a patient have visual acuity 6 by 60, 3 by 60. He will belong to which category of blindness? If you can answer it, I will be very happy with you, because it's a tough and confusing question. 6 by 60, 3 by 60, where will you put it? So do remember, they ask it again and again, the definition of blindness. And for the definition of blindness, it should be less than 3 by 60, not less than or equal to, only less than 3 by 60 in better eye with available correction. And in recent FMG also they have asked this definition only. So social blindness is the blindness, okay, less than 3 by 60 in better eye. And with this definition, it is clear that we always have to look in the better eye. And out of 6 by 60, 3 by 60, which one is the better eye? Better eye is definitely 6 by 60. 6 by 60 means what patient can see from 6 meter, normal person can see from 60 meter. So 6 by 60 is better. That means what is the answer to this question? To answer it, let's revise the classification of blindness. You can remember it by the mnemonic LESMA. Not lesbian ma, it means choti ma. So L for low vision, which is 618 to 660. Economical is less than 6 by 60 to 3 by 60. When it is less than 3 by 60 till 1 by 60, we call it social. And less than 1 by 60 is manifest blindness. And if there is no perception of light, then we call it absolute blindness. So here we have given 6 by 60, 3 by 60. We have not given less than 6 by 60. If I ask less than 6 by 60, then answer will be economical blindness. But if I say till 6 by 60, 6 by 60 will belong here in low vision, not in economical blindness. And we have to classify it according to the better eye, which is 6 by 60. So the correct answer is low vision, not economical blindness. Okay. One more thing is, this low vision is known as moderate low vision in WHO criteria. And WHO criteria is same as this, almost same, but only thing is they have mild low vision less than 6 by 12, moderate 6 by 18. Economical is known as severe low vision, which is less than 6 by 60. Social blindness is known as blindness category 1, manifest is blindness category 2, and absolute is blindness category 3. And Opthal PSM, both people ask question from this classification. So do remember it and do revise this tricky question. If they give you question with headphone-like appearance on peripheral smear, what does it indicate? Vivax or falciparum? Headphone or banana shaped, both indicate falciparum. And for falciparum, if they have not written that it is northeastern states, then drug of choice will be artesunate. If they have written northeastern states like Assam, then it will artemether plus mefloquine. And artemether plus mefloquine is given in 1:6. So if artemether is given 20, mefloquine will be given 120. Second thing they can ask is, a patient went from Assam to Delhi or Delhi to Assam, which drug of choice you will give? So no matter whether it is Assam to Delhi or Delhi to Assam, in both of cases, the answer is same. It is option C, artemether plus mefloquine. Sorry, it's not mefloquine. I was in a hurry, so I write it mefloquine. Artemether plus lumefantrine. Lumefantrine. And it is given in the ratio of 1:6, 20 to 120. So it's whether Delhi to Assam or Assam to Delhi, because northeastern states are resistant to artesunate. So we will give artemether plus lumefantrine. Third way question they can ask is, there is a pregnant female with vivax. Pregnant female with Plasmodium vivax. What is the drug of choice you will give? So if it is pregnant female with vivax, we cannot give primaquine, because primaquine is contraindicated in infant pregnancy and G6PD deficiency. Then answer will be chloroquine. Okay. And if they say pregnant female with falciparum, if they say falciparum, in that case, we will give the answer quinine. In first trimester, artesunate is contraindicated and they have not written the trimester. So then the answer will be quinine. So these are the 5-6 questions which come from the management. Do remember it. And if they will give you the peripheral smear of vivax, in the vivax peripheral smear, the RBC will have dotted granules. This is for vivax. And which slide will make us differentiate between vivax and falciparum? Thin blood smear, thin blood slide. And they make MPW by active surveillance. They will make two type of blood smear, thin and thick. So thin blood slide will tell about the species. That will be able to tell the fine detail of gametocyte and species. Now, second type of question they can ask you by giving you graph, and they can ask which type of epidemic it is. Like here they have talked about cholera epidemic and they ask which type of epidemic it is. So to decide it, you should know the incubation period. Incubation period for cholera maximum is 5 days. That means symptoms will appear up to 5 days. And incubation period is needed for quarantine. Infectivity period is needed for isolation. So if all cases occur in 5 days, then we call it point source. Point source means all case in one incubation period. But if time taken is more than one incubation period, it can be either common source continuous or propagated, because these two things, A and D, are the same. Common source single is same as point source, and example of both of them are food poisoning in your boys hostel, mostly come under it, plus Bhopal gas tragedy, Chernobyl tragedy. They all are point source or common source single exposure. So here, the time, if you see, the cases start from 4th and then it keep on happening till 61 day. So you have to look at the day. Total day taken is 57 day, which is definitely more than the incubation period of 5 days. So it cannot be point source. It is either continuous exposure or propagated. Now, if it is propagated always have secondary wave of cases, which is clearly much more than the primary wave. Very high secondary wave occur. Then you call it propagated. Okay. If there is no secondary wave, it is not propagated epidemic. And if you have cases of cholera like this, starting from 28, let's say, going till 12, it is again taking more than 5 days. More than 5 days, then we call it continuous common source. Continuous common source if more than one incubation period without secondary wave. If it is more than one incubation period with secondary wave, then we call it propagated. So here you can see in our question, secondary wave is not there. It is just going and then coming down. Now someone can ask, sir, why this is not secondary wave? This is not secondary wave because it is occurring in one span. In just 160 days duration, all cases are coming. Secondary wave will take a gap and then will occur after a gap, and the secondary wave cases are much more than the primary wave. Okay, so this is not of propagated epidemic, this is an example of continuous exposure epidemic. And this all graph are taken from this one page in international journal, which say that point source, let's say they are talking about salmonella, hepatitis A. For hepatitis A, incubation period is 10 to 50 days. Okay, so cases start occurring from 27 of April and keep on happening till 21 May. That means cases occurred within 30 days. So because cases occur in less than one incubation period in 30 days, we call it point source. Okay, and here duration is more than one incubation period without secondary wave, we call it continuous common source. Here, of course, for measles they are talking, and for measles incubation period is 10 to 14 days. But our cases keep on happening from 4th April to 18th May. That means more than 1 month period. That's why, and secondary wave is also there. That's why it is propagated. So if you get this question about salmonella, which has incubation period of 1 to 3 days, and cases are coming from 13 May till 16 May. That means roughly 3 to 4 days occur. So incubation period is 3 days. And cases are coming in 3 to 4 days, which is equal to one incubation period. So you will call it point source epidemic because cases are within one incubation period. Okay. So this is different type of epidemic which you have to answer. Second type of question, which I have discussed earlier also, but this is so confusing that I can't miss this. They can ask total number of live birth per 1,000 women in reproductive age group is known as. What is the answer? Can you reply? This is not total fertility because 1,000 word is written. If you saw total live birth per 1,000, then answer is general fertility rate. If they just say total live birth per female, then your answer is TFR, per female total live birth, and only those between 15 to 49 can produce. So per female is TFR, per 1,000 is GFR. Now, how will you differentiate between NRR and GRR? First thing is NRR or GRR, they both will be the answer only if in the question you found girl word written. If girl word is not written, then don't think them as answer. And along with girl word, if you also found mortality written, mortality rate and girl both are written, answer become net reproduction rate. So what is this two thing? GRR simply means girl live birth per female. How many girl produced by one female? Okay, because nature, for nature, girl are more important. They can give birth to new life. Boys are just for time pass. They are not so important. So nature focus on girl. We focus on girl population mainly. So when it is girl live birth, one female, how many girl child? That is GRR. But does all the girl child who took birth, will they survive till their adulthood? No, they will die before becoming 15 year also. Some of them will die. So if you remove those girl child number who died before 15 year, then it become NRR. So what is NRR? NRR is girl child per female considering mortality rate, considering those who died, considering mortality rate. So my brothers and sister, focus here. If they say total birth per female TFR, total birth per 1,000 female GFR, total girl birth per female GRR, total girl birth per female considering mortality NRR. So mortality girl both written, only then tick NRR, and only when 1,000 is written, 1,000 in total birth, then tick GFR. And do remember that if NRR is equal to 1, then there is 2 child per couple, hum do hamare do, and for this 2 child per couple, we need to provide protection to 60% of couple. And 60% should be the couple protection rate for that. Next question is about Anemia Mukt Bharat. It's one area which you should not mix. At least one question will definitely come from this part. And they are asking the dose for adolescent IFA tablet. So adolescent get blue tablet. Blue is there in 3. pink tablet of 45 milligram iron and 0.4 microgram, not mg. They can write 400 microgram or 400 mcg. These both are same thing, and this can be written as 0.4 mg. Okay, so this pink tablet is for 5 to 9 year children, and once a week tablet is there. So the same once a week is also followed for adolescent, once a week tablet, and dose is 60 and 0.5. So this dose is for adolescent. Correct answer is C. And this last dose is for 5 to 9 year pink children, pink, and usually blue film first time we watch in adolescent. So adolescent, blue color, 10 to 19, and the dose is 60.5. Then adult female bleed in menses, so adult female get red color tablet, and red color is also given once a week. So that's why the mnemonic which we made to remember it is PBR, pink, blue, red. All are once a week, just like PVR, release movie, once a week. And in red, the dose is same, 60 milligram plus 500 microgram. But when we give it to pregnant and lactating female, we cannot give it once a week. So in pregnant and lactating, we give it 180 day before and 180 day after delivery. And when we give it, do not forget that the dose is same, 60 milligram iron and 500 microgram folic acid. So that means we cannot give iron in the first trimester. Do not give iron in less than 12-week period of gestation. No iron there. Okay, this was one of the question NEET exam. So if they ask what is 6 into 6 into 6 strategy in Anemia Mukt Bharat, the first 6 are the people who will get the benefit. The second 6 are the interventions which will be given to them, the benefit given, and the last 6 are the mechanism, institutional mechanism by which we give the benefit. And in recent FMG exam, they have already asked what are the benefit given to them. So first benefit is iron folic acid, second benefit is albendazole. And remember, the National Deworming Day is 10th of Feb. So if you meet anyone 4 days before Valentine's Day, don't forget to put a tablet of albendazole. And if the couple will ask, "Hey, क्यों गोली खिला रहे है, क्या मूड है?" तो क्या बोलोगे? It is just to kill your worms. तेरे कीड़े मारने के लिए है ना. So 10th Feb is the National Deworming Day. Other than that, there is BCC, behavior change communication. We will say solid body will occur to you and the child will eat it because they want to hit all the children of the street. And if we will say to the mother that the child will have a smart mind when you eat it, then mother will also take it. So behavior change communication is the logo of the program, solid body, smart mind. After this, the fourth benefit is focus on other cause also, like malaria, fluorosis, and sickle cell anemia, hemoglobinopathies. Fifth reason is food fortification with iron. That is the fifth benefit. We want to add iron folic acid in the food or salt. Last benefit is digital HB measurement and follow up. And for this follow up of high risk cases, we are giving Anmol software, tablet based software to ANM. Okay, for follow up of pregnancy. Okay, so I hope you will remember all the 6 benefits which are there, benefit interventions which are there, BII. Plus one thing more they can ask is, what is the target in Poshan Abhiyan? In Anemia Mukt Bharat, the target is 3% reduction. But in Poshan Abhiyan, the target is 2% reduction. And what 3 things we want to reduce 2% reduction? In undernourished population, undernourished means low weight for age. Then in stunted children also 2% reduction, and undernourished, stunted, undernourished children, stunted children, and low birth weight, less than 2.5 kg. All these 3 should have 2% reduction. That is the target of Poshan Abhiyan. When it comes to global hunger index, in global hunger index, the first target is undernourished. First thing which we measure is undernourished. Second thing which we measure is stunted. Third thing which we measure is under 5 mortality rate. And fourth thing which we measure in global hunger index is the wasted children. So do remember, in Poshan Abhiyan, there is no wasted children. Poshan do not focus on acute malnutrition, because wasting means low weight for height. If low weight for height is there, less than -2 standard deviation, then we call wasting, and wasting indicate acute malnutrition. So Poshan do not focus on acute, Poshan only focus on chronic malnutrition, because stunting is low height for age and it is indicating chronic malnutrition. Stunting indicating chronic malnutrition. And undernourished is low weight for age, which is indicating both acute and chronic, or any one of them. Okay, so do remember these things. In PDA, PSM, both they ask it. And in global hunger index, IMR not a target. And this is not a target of global hunger index. Now, next question they can ask is about the life cycle of a family. What is complete extension, complete contraction, all those things. So do remember this event, very easy to remember. Formation is when you will marry and you will have first child. Then the family will start extending with birth of first child to birth of last child. Main question they ask from complete extension. In complete extension, one child is leaving home. So you will say, sir, how it is extension if child is leaving home? Before that time, it is extension. Before the first child leave home, it is extension. So as soon as first child leave home, complete extension end. So what is complete extension? Complete extension means birth of last child to first child leave home. That is complete extension. After complete extension, contraction start, where the first child and then last child also leave home. Complete contraction will have death of one of the husband or wife, and dissolution will have death of both of it. So please do remember that child is leaving home, but still it is under extension. Okay, and do remember this cycle, very important. Acha, estimated average requirement, you all know it fulfill need of 50% population, but recommended dietary allowance, it fulfill need of 97.5% population. So which one will be better? Of course, RDA will be bigger and better because it talks about the whole population. Which is done before pasteurization, we do methylene blue test. All three are done after pasteurization. Only methylene blue will tell us whether the quality of raw milk is good or not. Okay. And I hope you all know, in the pasteurization, if it is 63 degrees Celsius for 30 minutes, then we called it Holder and Watt method. So very easy to remember. It is 3 here also, 3 here also. And if it is 72 degrees Celsius for 20 seconds, then we call it high temperature short time. So again, you can see 2 and 2, 3 and 3. So you will remember it, I hope. Now, in an experiment, if we are replacing a smaller one with bigger one, there will be no effect on median. Median beech ka hai. Median always remain between mean and mode, and median is not affected by changing bigger number. So if I gave you this BP, let's say systolic BP, 124, 126, 128, 188, and I ask which one is best measure of central tendency. Best measure of central tendency will be mean, median or mode. Your answer will be best measure will be median. Why not mean? Because there is a big number at the end. Whenever there is a big number at the end, mean is mean minded, mean get deviated towards the big number. But median beech ka hai. Median always remain in the center. Median don't get deviated by big number. So that's why the best thing, if there is big number given, we will use is median. And if I am replacing a small one with big one, then mean will increase. Median will remain same. Only thing will happen is mean will increase. And if I change big to small, let's say 93 is changed into 39, then mean will decrease. So if I am changing a small with big, mean will become big. Okay, and median will not be affected. Median will remain same. By changing bigger number, median has no effect. If they show you image of a child with protruded abdomen like me, will you call him as protein deficiency energy or both protein energy deficiency? Do not dare to call them both protein energy. It is only protein, because if it is both, it becomes marasmus. And this is a child of Kawas-Yorker, which is protein deficiency only. If they say deficiency of essential fatty acid ADEK, that lead to phrinoderma. The image is given below here. That is phrinoderma. And do remember that in this child of Kawas-Yorker, there will be these two questions that they keep asking. He will have fatty liver. Of course, he will have flag sign. But along with that, will this child be interested in eating or not? Not interested in eating. Okay. And one common question they ask is the castle neck appearance around neck, which is for, of course, pellagra, niacin deficiency. Very common, castle neck appearance. First investigation in diabetic patient, if you want to know about TB, what is the first thing you will do? So whether it's diabetic or HIV or COVID or pediatric TB or previously treated TB, in these five, the first thing which we do is direct CB-NAT. In 5 people, we don't do ZN smear. But other than these 5, in other, if they ask, first investigation will be sputum smear examination. Similarly, they can create question that 2 sputum smear AFB is negative, X-ray suggestive of TB. What is the thing which you will do? So if 2 AFB negative, we will go for CB-NAT. Okay. Next question, and if they ask what is the best test to know spread of TB? Spread of TB infection, because when they say spread of TB, first infection will go, and infection is not measured by ZN smear. Infection is measured by tuberculin. So if they say spread of TB, it's tuberculin test or annual rate of tuberculin in conversion, ARTI, ARI. Annual rate of TB infection is the best to know spread of infection. If they ask what is the gold standard for TB diagnosis, answer is liquid culture is the gold standard, because CB-NAT can sometime overdiagnose some atypical mycobacteria also as TB. That's why we have more faith on liquid, because there the colony characteristic will be there and we will not overdiagnose. Okay, so for screening of cases, we use sputum smear, except in 5 people, and the gold standard is liquid culture. But for infection measurement, we use tuberculin test. In a hospital, we are doing systematic observation of record of doctor spending time with patient care and time without patient care. So let's say you have to choose one among 2 doctors, and you are comparing them based on time taken to do specific work. This is known as work sampling. So comparing can be done on 3 ways. If it is done based on time taken, it is work sampling. If it is done based on opinion of the people, consensus of group of people, then this is known as Delphi method, when you take feedback of the people. And if the comparing is based on the cost effectiveness, like let's say there are 2 surgeons, both are asking you to pay 3 lakh salary per month, but one is also doing marketing activity for hospital, one is doing some extracurricular work for hospital at same price. So you are choosing them based on cost effectiveness, who is more cost effective, and this will be known as system analysis. Okay, so based on time taken work sampling, consensus people, Delphi method. Delphi method is a group method, because here you are taking opinion of group of people, and extracurricular work, that is system analysis. If I say that out of 50,000 rupees, 35,000 go on category X drug, 10,000 goes on category Y drug, and 5,000 goes on category Z drug, which type of drug store management, inventory management technique it is? It is known as ABC analysis. In ABC analysis, we give 70% fund to those drugs which are always needed, A for always. Then we give 20% fund for those who are better if present, and we give 10% fund to those who are kept as control. That is ABC analysis. So if we are dividing the fund like this, 70, 20, 10%, it is ABC analysis. In a step approach, which tests are not done? So do remember, step approach do not include theoretical, and they include BPH. They include behavioral factors, they include biological factors, they include physical factor, and behavioral can also called psychological factor, and biological can also be called as hormonal factor. So the mnemonic is दो बम पे दो हाथ, है ना, BPH, benign paroxysmal hyperplasia, और बम पे हाथ, है ना, hand on bum. So these factors are included. Not included are therapeutic factor. Therapeutic factor are not included. And that was a PYQ of NEET. Now, which test is not included? For that, one of the students suggested this is a very good mnemonic, BTR love. What does B stand? It stands for BP and BMI, body mass index. T stand for thyroid profile. R stand for random blood sugar. And L stand for lipid profile. So the various tests which are done can be remembered by BTRL. Now BP, BMI, thyroid profile, random blood sugar, lipid profile. So which is not done? LFT is not done. Okay. Next question. This type of image, they can see rash starting on face, then covered the trunk, or rash started on back of hairline, then go to face. Or image of child where rashes are not coming out. If they coming out like beak of chicken, then it is chicken pox. If it is not coming out mixed with each other and all, that is definitely measles. One more thing is, only measles will have runny nose and all. If it is chicken pox or rubella, it is always dry fever in chicken pox and rubella. One more thing you should know is, in chicken pox, varicella zoster immunoglobulin, first preference we give to is given within 72 hours. First preference we give to pregnant lady, and there is no need to give varicella zoster immunoglobulin in any hostel, because in hostels usually we have people who are not infant or old age or pregnant, so it is not given in hostel population, this varicella zoster immunoglobulin. Isolation period for chicken pox is 6 days. Isolation period for measles day is 4 days before rash, 5 days after. So you can either remember 4 days before and 5 days after, or you can remember 3 days after catarrhal stage. Same thing, 3 days after catarrhal stage. Okay. And for measles, the most common complication is middle ear discharge, otitis media. For chicken pox, the most common complication is secondary bacterial skin infection with Streptococcus. If in NVVDCP you have to spray malathion, it should be done once every 3 months. But for DDT, it is sprayed once every 6 months. That is why, what is the insecticide of choice? DDT is used in national program. It is the insecticide of choice in national program. One more thing they are asking a lot of this day is about larvicidal drug and larvicidal fish. Fish, I hope you all know. Fish is Gambusia and Guppy. But drug you should know, Gambusia and Guppy are there as the fish. Drug are 3, Tamifos, Abate, and Paris green. Paris green can also kill adult by working in stomach. That's why Paris green is known as stomach poison. Okay. Now, which is indicative of severity or lethality? That is case fatality rate. Like for rabies, it is 100%. What is case fatality rate? They can give you a small numerical on that also. We will write the case here, and out of that case, how many death occur due to that disease, death due to that disease. Okay, and then we multiplied by 100. So if they are asking about TB and they are saying out of 100 case, 5 death due to TB occur, what will be the case fatality rate for TB? 5 by 100 into 100, it will be 5%. And for rabies, it is 100%. That means if rabies 100 case occurred, out of that 100, all 100 will die. So severity is by case fatality. Protein requirement, they can ask you for 65 kg or for 95 kg female. No matter what is the weight, always the answer will remain 45 gram. Why? Because this recommendation of protein we give based on reference female and reference male. And for reference female, the weight is 55 kg. And for every kg, protein needed is 0.83 gram per kg per day. So if you multiply 55 with 0.83, it will roughly come 46 or 45. And if I am 95 kg and I started taking 95 into 0.83 gram protein, then there will be more part hanging from my body. So advice should not be given that whatever is your weight, take 1 gram protein. Not like that. The advice is given based on reference female and male. That's why all the students who are listening to my class right now, all of you, your reference weight is 65 kg. So all of you should take only 55 gram protein per day, not more than that. Unless you are doing some gym or something other than that, then you can increase it. And all the female listening to me should take only 45 gram protein per day. Okay, you can remember weight, you can remember height also. Height for female is 162 centimeter, for male 177. So in the weight, the difference is of 10, in the height, the difference is of 15 centimeter. Then they can ask BMI and age. BMI is a bit higher for female, 20.95. For male, it is 20.75, lesser than that. And age for all is 19 to 39 year, 19 to 39 year. Just to include me in this category, they increase it from 29 to 39. So do remember, if they ask female, don't look at the weight, directly put 45. If they ask male, don't look at the weight, directly pick 55. Okay. In different type of graphs, secular trend or any trend, if they say, trend simply means line diagram. If they say incidence with time, how will you measure incidence fluctuation with time? So if they say with time or trend, mostly answer will be line diagram. And they can ask you what is the example of secular trend. Example is cardiovascular disease. You know, in the world since 1950 till this date, cardiovascular disease is increasing. So if the disease are increasing constantly at a fixed rate or decreasing constantly at a fixed rate, then we call it secular trend. Example are cardiovascular disease, and it is represented by line diagram. You can see it. A researcher undertake follow-up study for a certain time period and tell the people increasingly develop disease with time. If the people are developing increasingly disease with time, then this is known as incidence rate. What is incidence rate? Incidence rate is defined as new cases by total cases which will be there multiplied by time for which they suffer. Okay, person into time will put. So whenever they put time in the question, answer is incidence rate. New cases added over time, answer is incidence rate. Okay. If the CD4 count question they ask again and again, this exam they ask about Kaposi sarcoma. And then they can ask that if the CD4 count is less than 100, not at risk of which of the following? See, Mycobacterium avium complex occur if CD4 count is less than 50. And here they are saying less than 100. So less than 100 also include 51 to 100. And between 51 to 100, Mycobacterium avium complex do not occur if CD4 count is between 51 to 100. So which infection not at risk of? Answer is MAC. But for Kaposi sarcoma, what is the CD4 count they have asked? So let's see this diagram from Park. Very easy to remember. 4 things are at less than CD4 count 50. What are that? MAC, histoplasmosis, CMV retinitis, CNS lymphoma. Remember these 4. MAC, histoplasmosis, CMV retinitis, and CNS lymphoma at less than 50. Then between 50 to 200, there are all the things with OSIS are between 51 to 200. Only one OSIS, histo, because it is history, is less than 50. All OSIS are between 51 to 200. And one more OSIS, tuberculosis, is when it is more than 200. More than 200 is only one OSIS, tuberculosis. Less than 50 is only one OSIS, histoplasmosis. Rest all OSIS are between 50 to 200. So Kaposi sarcoma will occur at a CD4 count more than 200. They can give you in option 200 to 400 and that will be the correct one. I hope you will remember MAC, histoplasmosis, CMV retinitis, CNS lymphoma. At less than 50, it will occur. So at less than 100, these four will not occur. Next question is, in a school scenario, what is the correct answer? Do they give 5 square feet? Answer is no. In school health, they give 10 square feet. And what is the space which they give in occupational health? In occupational health, per worker get 500 cubic feet. And only up to 14 feet above their head, we will count the space. We will not count, because when they give the criteria 500 cubic feet, a lot of factory people, they start making rooftop very high and start counting that space. So they say no, only above 14 feet their head, they will be counted. Their head, it will be counted, not above that. So for occupational health, this is the space and only up to 14 feet. For student, it is 5 square feet. Desk is not positive. Desk is minus desk. So this line is also wrong. This line is also wrong. Can allot 40 student? Yes. One class 40 student, urinal for 60. And if you mix student with susu, it will become 40. So latrine, if they ask, it is for 100 student. Light should coming not from front. Light should come from left side of the class. And 25% area should be door and window. Okay. And do remember, school health program come under mission in Ayushman Bharat also, and it also come under PHC Vision Center. Now, if a child has history of frequent exposure to Panicum miliare mixed with crotalaria, he develops swelling of abdomen. What is the poison? A lot of time they ask question on food adulteration. Do remember it? Swelling of abdomen means पेट फूल गया है. Abdomen means पेट, है ना? In Hindi, है ना? पेट फूल गया. So the poison is also from P, pyrazolidine. If they say ascites, endemic ascites is due to Panicum miliare mixed with crotalaria, and in this ascites, abdomen will pate or abdomen will be swollen. So poison is pyrazolidine. But if they say you that there is someone who is having a grocery shop, and in the grocery shop they are selling some adulterated food. It can be mustard oil also, adulterated mustard oil. And due to that, people start developing dyspnea and congestive heart failure like feature, or they started developing bilateral pitting edema. And what is the poison which will occur? So the poison is sanguarine. And why this poison is there? Because mustard oil is mixed with Argemone mexicana, which is also known as Satyanasi, destroyer. So this Argemone mexicana and mustard oil both have black seeds, in that yellow color field, both can grow. And sometimes the shopkeeper, they mix it to reduce the price of mustard oil. So do remember that in this, the poison is sanguarine, and this disease is known as epidemic dropsy. So how will you remember it? The poison is sanguarine, S for sanguarine, S for sleeping. So imagine you are sleeping together with someone of your dream. When you will sleep, there is dropping of eyelid. And the symptom is also pitting edema, dropping inside. So S poison, sleeping, sanguarine, dropsy, and symptom is also pitting edema. If they give you the history of contaminated groundnut or maize, and then they will give you history of hepatocellular carcinoma, then that poison is aflatoxin. If they give you that someone is eating rye or wheat, and after this there is cyanosis or necrosis of finger, then that is ergot toxin. And I hope you all know, if they give you history of people from Chhattisgarh or Bihar eating rice pulses, and then they have cross leg walking on toe. So cross leg walking on toe definitely means neuroletharism along with spasticity and all. And in neuroletharism, we give vitamin C as treatment. The poison is beta oxalyl aminoallyl. So these are the 5 adulterant which you should revise before exam for sure. What is this statistical diagram? When the students see it, many of them, they answer multiple bar diagram. But my friend, multiple bar diagram will have gaps again and again at similar interval. And this type of diagram will be multiple bar diagram with gap again and again. This is multiple bar diagram. Here, the gap is not again and again, gap is at irregular intervals. So the answer is histogram. One more thing they can ask you is that I want to represent that health system not working, health system failure reason. Which diagram will be best? So the best will be fishbone diagram or Ishikawa diagram. In fishbone or Ishikawa, we try to enumerate various reasons through this type of a structure, and then one by one we will point out what are the reasons for that. So this is Ishikawa fishbone diagram, best qualitative data representation method. Now, if there is blood spill, we are using 1% sodium hypochlorite, but this 1% sodium hypochlorite is used after wiping the floor. After wiping the floor with cotton or something, then we pour sodium hypochlorite. 1% is Indian guideline, WHO guideline is 0.5%. If they say man come for checkup after his father had cerebrovascular accident due to hypertension, so no matter which position they are saying, if they use the word checkup, checkup is only for early diagnosis of illness. Whether the checkup is in the sun or the checkup is on hemiparesis patient, purpose of checkup is to find out early diagnosis of next attack or early diagnosis of uncontrolled hypertension. So whenever early diagnosis and treatment is there, diagnosis answer will directly be secondary. Do remember, all checkup, all screening test, whether it's done in children or adult or anyone, everyone, if they give screening test in healthy or 10-year also, answer will be secondary. If they give you image of filariasis patient foot care, all patient foot care will come under disability limitation. Okay, that is tertiary level of prevention, disability limitation. If they ask about mother and child care or breastfeeding, then it will come under health promotion, because health promotion include both primordial and primary. If they ask about Indian diet or yoga and all those things, that will be primordial. Okay, so just if they ask about refractive error glasses, that is tertiary, because tertiary purpose is to make us self-dependent, and refractive error glasses is not curing the illness, it is making us self-dependent. So whenever we are self-dependent, it is tertiary. Early diagnosis treatment is always secondary, and here in this case also there is checkup, so it is secondary. Okay, now next question is, which is not a principle of primary health care? Community participation, appropriate technology is a pillar. Adequate technology is not pillar, but appropriate technology is a pillar. Intersectoral coordination is also a pillar. Equal distribution is not a pillar. The actual pillar is equitable. So you have to remember the pillar with their spelling also. Equitable means giving more to those who need more. So equitable distribution is a pillar. And they have asked one time in INICET that what do you mean by community participation? It means involving community in not only doing the work, but also monitoring the work. Involving community in planning for work and monitoring for work also. Like everything should be done by them. You should just be working as a facilitator. So these are the 30 questions I have done, but I would like to do some 5 more extra questions. Botulism will come under A. Under C, there will be Nipah and Hanta only. And Nipah, of course, you know, date palm sap. And they can give you image-based question also. Date palm sap or pig. And this is a pig I am drawing. Pig or date palm sap is the transmitting agent. With category A, there is 7 things. Anthrax, botulinum can be remembered together. Then the 2 things is smallpox and plague, the old illness which is almost gone. Then there is Ebola and Marburg, Conbola, Ebola and Marburg, which both are viral hemorrhagic illness. So 6 things. And last is tulluremia. So all 6 are in pair. Tulluremia is disturbing the flow. Yahi bhadwa. This is disturbing the flow. So do remember, botulinum, anthrax, they all come under A and these all come under B. So that's all from this series of 30 important questions. Of course, there is one episode which I took of 100 questions. If you can see that in fast forward, in those 100 questions, only one of these 30 questions I have discussed. Rest all are different questions in this session. If you revise that 100 plus this 30, I am very sure that if 30 question came, from the topics which I have discussed. At least 25 will be from the topics which I discussed. Thank you so much for this session. I wish you all the best. While going to the exam center or in today night, try to read only those subjects in which you are strong. Don't read new things now. Read strong subjects and revise your PYQ. Of course, go with a positive mind, like this is a game which you have to play and perform well, because exam is not a life and death situation. It's always to check whether I am playing well or not during that 3 hours, and you will perform well when you will be playing it. You are giving an exam like a game, you will give it much better. Okay, and while going on the way, only revise your strong area or PYQ. Okay, thank you so much. Bye bye. Hasta la vista. Tasvidania. We'll meet again. If you have anything to say, feel free to say it. How many questions we can expect from PSM? 25 question. Around 25 to 30 question will be there, I hope, from PSM. Dr. WHO is finding PSM interesting for the first time. Thank you so much. He's saying आप जैसा PSM नहीं कोई पढ़ाता. शुक्रिया भाई डॉक्टर. Thank you for. Manifest blindness is less than 1/60. Okay. In better eye with available correction. Okay. Entomology से क्या आ सकता है? From entomology they can give you this trombiculid mite. Trombiculid mite. What does it transmit? It transmit, of course, which type of trombiculid mite? It transmit Orienta Tushu gambushi, and Tushu gambushi will cause which thing? Scrub typhus. One question is this, they can ask from entomology. Second they will give is track has been formed. So if you found track formed, it's definitely scabies. If you found family member have the itching, that is also scabies. And scabies, scrub typhus and rickettasial pox, all three are transmitted by mite. So you can remember it by RSS or PSSM. Okay. Then again and again they have asked that if they will give you history of human bite with insect, then develop fever and rash, most likely this illness is epidemic typhus. Epidemic typhus is caused by Rickettsia prowazhaki. There is power. So epidemic typhus is there. Power. And a power. And it is transmitted by louse. Louse transmit 4 disease: pediculosis, epidemic typhus, relapsing fever, and trench fever. This trench fever is known as Quintaniac fever. So if they ask who transmit Quintaniac fever, it will be louse. But if they ask who transmit Q fever is transmitted by air. And the causative organism is Coxiella burnetii. It is different. But Quintana is trench fever, and that is transmitted by louse. So this is 2 part which I am expecting. Of course, you have to read the whole part. Thank you so much for this beautiful reply and this beautiful session. Nikhil bro, let's give them the time for revision. Thank you so much. We are going to end the session now. Nikhil, Chahat, end kar do. Thank you so much, bro. Thank you, Binu, Hankit, Vrushali, Lovely Dubey, Dr. Who, Dr. Stephen, and all my friends who replied and participated in this session. Love you all. All the best for your exam. Bye. Thank you so much.
सब बढ़िया आप कमेंट लाइक करते हो फॉलो करो मेरे को सब बढ़िया आप कमेंट लाइक करते हो फॉलो करो मेरे को सब बढ़िया आप कमेंट लाइक करते हो फॉलो करो मेरे को सब बढ़िया आप कमेंट लाइक करते हो फॉलो करो मेरे को सब बढ़िया आप कमेंट लाइक करते हो फॉलो करो